symptoms of this condition vary, but very often there is fever, headache, the patient looks very unwell. If there is meningitis rather than sepsis, because very often these patients get both, apart from the headache, there would also be neck stiffness. So the patient is unable to push the head forward without having pain. So you see these children that are not moving, crying, and eventually they become very lethargic and irritable. Later on, when they develop sepsis, the body starts to have problems with blood clotting, and we end up with either a lot of bleeding or otherwise little blood clots. These blood clots eventually will clog the main arteries and veins. Now obviously arteries and veins supply organs, and they supply our fingers and toes and arms and legs, and depending where these blood clots end up, we end up with problems. So if the blood clot ends up in the heart, you have a heart attack. In the fingers, we end up losing these fingers and toes. But I've seen others lose kidneys and ultimately even death.